Gentlemen, I need you to stop scrolling for just 1 second, because what I'm about to tell you in this video is something most men don't find out until it's already too late. And I don't say that to scare you. I say it because I've spent over 2 decades as a urologist, and I've sat across from thousands of men. Young men in their 20s who thought they were invincible, middle-aged men in their 40s who were too busy to pay attention, and men in their 60s and 70s who finally walked through my door wishing they had done it years earlier. And do you know what the most common thing they say to me is? Every single time, without fail, they look me in the eye and say, "Doctor, I wish someone had told me this sooner." And that breaks my heart. It breaks my heart because I know that most of what I treat could have been prevented, managed, or even reversed if only they had known. So today, I'm going to be that someone for you. I'm going to tell you the things your regular doctor might not have time to say. The things nobody talks about at the dinner table or over drinks with the guys. And the things that, if you actually apply them, can genuinely change the trajectory of your health, your energy, your relationships, and your life. This is not a scare video. This is a love letter from a female urologist who has seen enough to know better. I've watched men suffer in silence. I've watched marriages strain under the weight of unspoken problems. And I've watched men completely transform their lives simply because they finally got the right information. So stay with me. This matters more than you realize right now. Hi, I'm Dr. Narita. I'm a board-certified urologist and men's health specialist, and I've dedicated the better part of my career to helping men understand what's going on inside their own bodies. Because let's be honest, men are not always the best at asking for help. And I get it. I really do. There's a culture around masculinity that says you push through, you don't complain, you handle it on your own. But your body doesn't care about that culture. Your prostate doesn't care. Your kidneys don't care. Your hormones definitely don't care. They are biological systems, not political statements. What I'm going to share with you today are the most important, most overlooked, and most impactful things I wish every man knew. Starting in his 30s, 40s, and absolutely by his 50s. Whether you're watching this for yourself or for someone you love, I need you to share it. This isn't just information. This is ammunition. This is the knowledge that could genuinely make a difference between a life of vitality and a life of quiet decline. Let's get into it, because we have a lot to cover. Let's start with the organ that brings most men to my office, the prostate. And I want to be really clear about what we're dealing with here. The prostate is a small, walnut-sized gland that sits just below your bladder and surrounds your urethra. That's the tube that carries urine out of your body. And for about the first 30 years of a man's life, it just quietly does its job. No drama, no fuss. But then, somewhere around age 40, and almost universally by age 50, that little walnut starts to grow. This is called benign prostatic hyperplasia, or BPH. And benign means it's not cancer. But let me tell you, it is absolutely not harmless. When the prostate enlarges, it squeezes the urethra. Imagine stepping on a garden hose. The water still comes out, but it's weak, it's slow, and it takes forever. Sound familiar? Here are the signs I need you to pay attention to. You wake up 2, 3, 4 times a night to urinate. Your stream is weak or starts and stops. You feel like your bladder never fully empties. You feel a sudden, urgent need to go, and sometimes you don't make it in time. You dribble after you think you're done. Now, men come to me and say, "Oh, I just thought that was normal aging." And here's where I put my foot down. Common is not the same as normal. Just because something happens to a lot of men does not mean you have to accept it as your destiny. There are treatments, there are lifestyle changes, there are medications, there are minimally invasive procedures that can genuinely restore your quality of life. But only if you speak up. Only if you come in. Please, don't wait until you can barely urinate to walk into a urologist's office. Early intervention is everything. I've seen men wait so long that their bladder starts to suffer permanent damage, and that damage is avoidable. Every single time, it's avoidable. Now let's talk about something that affects men profoundly, and yet most men either don't know it's happening or they feel too embarrassed to bring it up: testosterone. Starting around age 30, men begin to lose about 1% of their testosterone per year. 1% doesn't sound like much until you do the math. By the time a man is 50, he could have 20% less testosterone than he did at his peak. By 60 or 70, that number gets even more significant. And this isn't just about sex drive, though yes, that is affected. Low testosterone, which we call hypogonadism, shows up in ways that men often mistake for just getting old. Let me describe the man I see in my office. He's in his late 40s or early 50s. He's tired. Not just physically tired, but emotionally flat. He's gained weight around the belly even though his diet hasn't changed. He's lost muscle even though he used to be strong. He doesn't sleep well. He's moody, maybe a little depressed. His motivation is gone. His confidence has taken a hit, and his relationship is suffering because of the intimacy issues he's too ashamed to talk about. That man came to me thinking something was wrong with his mind. Half the time, it's his hormones. Now, I am not saying every man needs testosterone therapy. I'm not. What I am saying is this: if you feel like a dimmer version of yourself, you owe it to yourself to get your levels checked. A simple blood test, total testosterone, free testosterone, LH, FSH, can tell us so much. And once we know what we're dealing with, we have options. Lifestyle interventions first: sleep, resistance training, reducing alcohol, managing stress, optimizing nutrition. These all move the needle significantly. And when that's not enough, there are medical options we can discuss together. You are not supposed to feel like you're fading. That's not the deal. Don't accept it without asking why. I've had men come back to me after treatment and tell me they feel like they've been given a second chance. That's not hyperbole. That's the power of getting your hormones right. I need to spend a moment on your kidneys, because this is the silent one, the one that sneaks up on you like a thief in the night. Your kidneys filter about 200 liters of blood every single day. Every single day. They regulate your blood pressure, balance your electrolytes, produce hormones that tell your bones to stay strong and your blood to carry oxygen. They are extraordinary organs. And most men have absolutely no idea they're in trouble until they've already lost 50 to 60% of kidney function. That's the cruel part about chronic kidney disease. It has no symptoms in the early stages. You feel fine right up until you don't. The biggest risk factors are high blood pressure, diabetes, and this one surprises people: chronic NSAID use. If you're the guy who pops ibuprofen like candy for your back pain or your workouts, I need you to hear me. Over time, that habit damages your kidneys. Here's what I want you to do. Ask your doctor for a basic metabolic panel and a urine test once a year. That's it. Creatinine levels, eGFR, urine protein. These numbers will tell us if your kidneys are under stress long before you ever feel a symptom. And on the lifestyle side, drink water. Actual water, not just coffee and energy drinks. Control your blood pressure. Even slightly elevated BP quietly destroys kidney tissue over years. Eat less sodium. Restaurant food, processed food, fast food is absolutely loaded with it. If you have diabetes or prediabetes, take it seriously. It is the #1 cause of kidney failure in men. Your kidneys are working hard for you every minute of every day. The least you can do is not ignore them. I've had patients who only discovered their kidney issues because of a routine blood test. And I've had patients who discovered it in the emergency room. Trust me, you want to be the first one. All right, I know this is the part some of you have been waiting for. And I also know some of you almost clicked away because even reading the title made you uncomfortable. Stay with me, this is important. Erectile dysfunction. ED affects approximately 30 million men in the United States alone, and worldwide, that number is staggering. It is one of the most common conditions I treat, and yet it remains one of the most under-discussed. Here's the thing I need you to understand. And please, really hear this. Erectile dysfunction is not a character flaw. It is not a sign of weakness, and it is not just about sex. ED is a vascular condition. The same way a heart attack happens because blood can't flow properly through the coronary arteries, ED happens because blood flow to the penis is compromised. And here's the part